This 5-minute video is to address generalized knee pain. There's a number of activities you can do at home to manage that knee pain. We'll start off with some basic things. You're going to want to place a rolled towel underneath and behind your knee. You're going to gently grab the outside of your kneecap with your index finger and your thumb. And you're going to wiggle the kneecap side to side using your thumb and index finger very slow, all the way to the left, all the way to the right. You should never experience any pain during this motion, although it can start off being somewhat stiff and then get looser as you go on. And you're going to probably want to continue that in the left and right directions, or we call the lateral directions, for about a minute or so. And then move your hands 90 degrees so they're at the top and the bottom of the kneecap. And again, you can use your index and your thumb, or you can cup the kneecap with both hands and move it up and down slowly. Again, not experiencing any pain during the motion. Again, it could start off stiffer and then get a little bit looser as you go along. That towel roll underneath your knee is very, very important because it keeps your knee from locking or compressing down into your femur. The next you're going to do is a little bit of range of motions, but it's less stressful on the knee when your foot is in contact with the ground. So I'll have my assistant here take off his shoe, but not his sock. And you can lay on the floor or the bed and just slowly bend and straighten your knee, keeping your heel on the ground. We call this a heel slide. Slide all the way back as far as you can, and then all the way forward. And again, I don't really like repetitions. If you're better with repetitions, I would say somewhere between 15 and 30. However, I would probably just do this for about a minute. Slower the better. Pausing on either end. We call that a closed chain exercise because your foot is on a surface, so there's no stress on the joint itself, but you're still putting the knee joint through some range of motion. Next thing you're going to need to do is lay flat on the bed or floor, keeping your knee as straight as you can and your toes pointed up. You're going to lift that leg up about 12 inches off the floor or bed, keeping your knee perfectly straight. Hold it for 3 to 5 seconds. And if Jacoby can lower that leg a little bit, keeping that knee perfectly straight, and then lower back down. Just raise it up, and I'll tell you when to stop. Hold it right there. Hold it. 1 1,000, 2 1,000, 3 1,000, and lower back down. It's critical that your knee stays straight during this. If the knee is bent at all, then the thigh muscle, which controls the knee, isn't going to be doing any of the work. Keeping your toes pointed is just another way of making sure your knees stay straight. Pointed up. Pointed up. Yep. And again, I'd recommend doing this for at least a minute or a minimum of 12 to 15 repetitions. Next thing we're going to do is we're going to do a kinetic exercise, which basically means you're in motion. So you're going to sit out on the edge of a table or bed or maybe even a chair, and you're going to slowly come off with your feet on the ground. You're going to slowly stand up until your rear end clears that surface that you're sitting on. Maintain that mild squat, so go ahead and stand up. Don't come all the way up. Hold it, 3, 2, 1, and sit back down. If you're having knee pain at all, you may need to do it off an elevated surface, and we're going to do 12 of these. So go ahead and raise up, hold, 3, 2, 1, and back down. Excellent. And again, you don't have to go all the way up. Matter of fact, it doesn't benefit you to come all the way up. Just clear your rear end off the seat, hold for 3 to 5 seconds, and lower back down with the goal of being about 12. Excellent. And one more activity we're going to want to do is standing up. And in this case, he's going to place the back of his knee against the edge of that table. And he's going to keep his left foot forward and his right foot back, so he's in what we call a staggered stance. And he's going to push the back of that knee into that table, keeping in mind that's a cushioned table, so it shouldn't cause him discomfort. If you're using a hard surface, you could put a pillow or a towel roll back there, maybe the same towel roll you used for the kneecap exercise. And press the back of the knee into that table as hard as you can. I know you have socks on. It might be a little slippery, but you're doing great. Hold for about 10 seconds. You're about 3 seconds in. Relax that knee and bend it a little bit, but don't let the towel fall out. And then repeat immediately in a 10-second hold. We call that a terminal knee extension. And again, you repeat that about 10, 12, 15 times, holding for 10 seconds. And that is your 5-minute general knee pain exercise program. You can follow at home. I recommend them doing just one time a day. If you're having any pain during the activity, skip that activity. If you're having any pain afterwards, apply some ice. Thank you very much for watching.